talking over the last 30 days. That's the number of days that we've had a government shutdown about the overriding reason for that. And it's really this whole idea of tax credits for people who get health insurance through the federal marketplace. And we reported on KSL NewsRadio that more than 400,000 Utahns could probably see an increase in their insurance premiums by the end of the year, depending on how this all shakes out.
Yeah, that's right. And the Republicans are saying we're not going to deal with that right now. And the Democrats are saying we're not going to deal with anything else until we deal with this. So it's like it impacts real people, right? And when you're talking about, we have Republican Marjorie Taylor Greene who is saying, look, my kids cannot afford this type of increase. And it's not just my kids, right? It's people in my district who can't afford this. She's the one who's really been speaking out on the Republican side. But to almost take the politics out of it, if we can, we'll see. We have on the line with us John Pike. He's the Utah Insurance Commissioner. Welcome, Commissioner.
Well, thank you, Holly and Greg. Appreciate it.
So can you just explain to our listeners, what do these tax credits do for people who are accessing their health insurance through the federal marketplace?
Yeah, and to be clear, what's really kind of at stake here is what they call the enhanced advanced premium tax credits, and those were put in place during COVID, during the Biden administration, and it was to help people at income levels, at poverty level and above. In fact, even clear above 400% of the federal poverty level. And if people know roughly what that is, federal poverty level for a person of one, for an individual, is about $15,000 a year income, okay? And so we're talking about, people that don't qualify for Medicaid, for example, but do qualify for these enhanced advanced premium tax credits. And some of those are going to be, if this enhanced advanced premium tax credit system goes away, it expires at the end of this calendar year. And as you mentioned, Holly, Congress has yet to basically decide or include it in the budget. And so if they go away, what that means is approximately 422,000 Utahns that get their insurance through the federal marketplace on healthcare.gov, they'll be affected. About 32,000 of those people that earn 400% or more of that federal poverty level, they'll lose all of their premium tax credits. So what that means is where they were getting some assistance, they will just pay the full premium, on their own. Utahns with incomes that are below that 400% of the federal poverty level, they'll see reduced premium tax credits. So they'll still have some help, but it will still increase their out-of-pocket, premium costs. So would you like an example just really quick?
Yeah,
I know
absolutely.
So an individual who is at let's just say 200% of the federal poverty level. So, they would see a 351% increase in their monthly premium contribution. Now, what does that look like? What that means is going from $32 to $144. That's not a lot of money. But again, remember, that person's making $30,000 a year, so it might be a lot of money to them. And then a family of four at a higher income, let's say 400% of the federal poverty level, they would be seeing an 111% increase, going from, in other words, real dollars, $847 to $1,786 per month. So again, those are more dollars for a family of four that's not really making, a ton of money. That's 200% of the federal poverty level. So it does have an impact. And, it's not a state decision. This is, as you mentioned, a congressional, the U.S. Congress decision. But it certainly will have an impact on people here in Utah.
I mean, those numbers, especially for the family of four that you mentioned, to me, that sounds like almost unsustainable. So what do you anticipate Utahns, if this goes away, what do you anticipate Utahns who are currently getting their insurance through the federal marketplace, what do you think they're going to do?
Yeah, and that's the trick, of course. And the first thing we hope they'll do is that they'll work with their insurance agent, and most people typically do go through an insurance agent or a navigator. We hope they'll work with them. Open enrollment starts Saturday, November 1st. So that's why this is happening. This is hot off the press. This is happening now. Rates are out. So we hope they'll talk to their agents and that they'll shop. They'll say, well, can we look at a different plan? Can we reduce our coverage and therefore reducing our premium? Now, of course, that's a double-edged sword, right? Because then they have lesser coverage when they go to make a claim. So it's not a perfect situation, but that's kind of what we all do, right? As if the premiums increase, we have to make some decisions. Our employers make decisions. But in this case, it's the individual or that family that they're going to have to make decisions and say, well, can I get a lesser plan or a different plan where I save a little bit of money and offset some of that increase? That's the hope. If that doesn't work, then there's a less desirable option than that. But you kind of go to the old system, which is you could, again, through an insurance agent, you could apply and you'd have to be medically reviewed and underwritten to get what's called a short-term health plan. So that goes for a year. You can renew it for up to another year and renew that again for another year, and we'll see where that goes. But those cover less. They're not as comprehensive. They do cost less. They don't go through. They're not part of that Obamacare federal marketplace, but they're something, right? But not as desirable. But that's another option. The next thing, and it's not insurance, but it's available, and some people are doing this already. You might be familiar with what are called health sharing ministries, and they're not insurance, but you can join those, and they're faith-based groups that offer healthcare cost sharing plans, and so I'd rather have someone have that than nothing, but it's very different. And of course, then what I hope is they don't go to the worst option, which is become uninsured altogether, because that, and some, especially the more healthy young, they will tend to do that. And that's not good for anybody. It's not good for them, but it also takes them out of the risk pool, which, kind of makes the costs even spiral higher over time. So we hope that people won't go uninsured, and there's always the hope that maybe they've got a spouse, maybe, or even they themselves, maybe they now have a plan through an employer that they could join that maybe they didn't have last year. But, the hopes of that maybe aren't as high as some of the other options and the eventualities that could happen. So anyway, those are kind of the options that are out there, and we don't want to, say the sky is falling, but it's certainly going to be a challenge for a lot of people.
I have a really quick question that just came in from a texter. If this goes away, how would that impact other insurance companies or insurance premiums? Will it at all, or do you know?
Over time, I believe it will, because again, if you take more people out of the system, especially the young and healthy people, which will be, I think, the first to leave because they won't see the advantage of staying in. I think that makes the risk pool worse. That makes the experience worse for the insurance companies. You could, over time, see some insurance companies saying, gosh, we can't afford to really be in this business. It creates what we unfortunately call a death spiral, and so that could be a problem over time. And that's why I think it's up to Congress to decide and make the policy decisions, right? It's not even within the state's control, but hopefully it doesn't have too, especially in the short term, difficult consequences for people. And that's why, if they do find a way to make an agreement, I think that would lessen some of the financial impact on people. And maybe over time there are other things that the federal government could do. And I think it makes it even more important for us here at the state level as well as national level to find ways to truly reduce what we call the cost curve of healthcare so that, we can really begin talking about it being more affordable for Utahns and Americans period, across the board. This doesn't do that. This kind of, it's a temporary, it's a Band-Aid, but it might be a Band-Aid that's not easily ripped off in one fell swoop.
Thank you so much for joining us. That was John Pike, Utah Insurance Commissioner. And I just have to remind our listener that the ACA, the federal marketplace, it is the same thing as Obamacare. And there are sometimes there's some confusion about that.